Hi, my name is Dan Joyce. I'm a urologic oncologist at Vanderbilt University Medical Center and the section editor of the Renal Cell Carcinoma Diagnostics page for Oncology Now. I have the distinct pleasure of being joined today by Chinmay Jani, who is an oncology fellow at University of Miami and who has recently published a comprehensive review of liquid biopsy and renal cell carcinoma. So Chinmay, thank you so much for coming and talking to us. Really appreciate it.
Thanks a lot, Dr. Joyce. Thanks for having me. And thanks to the Oncology Now team as well.
Your paper is very timely in that I think all of us in geo-oncology are really, really excited about the things coming out of liquid biopsy. And I think a lot of us at this point are really struggling with its utility and how do we apply it? How do we use it? I think for some of us, we may not even really understand what it entails. So let's just start there, kind of big picture. What is a liquid biopsy? What do you mean by that?
So that's a great question to begin with. And what liquid biopsy is, the meaning itself is in the two words. The biopsy, but liquid, which means it's coming from blood. Technically, it's in a way similar to just a blood draw. But in the blood draw, we look into more tumor cells, or we look into more mutational burden in the tumor cells from the blood to analyze and help us understand how the cancer is going on, whether it's from diagnostic side to prognostic side to eventually help in decision making as well. I would say liquid biopsy is still in infancy. So a lot of things are still need to be done for further progress. But it can be divided into two main parts, which is kind of CTC, which is circulating tumor cells, and also ctDNA, which is circulating tumor DNA. Just talking more about circulating tumor cells. So when we take this blood sample and run this called liquid biopsy or checking into this mutational level, one way to look at it is through identifying the tumor cells itself. So these tumor cells can be coming directly from the cancer, like the primary site, or it can be coming from the metastatic site as well. And through different mutational analysis, through different assays and computational method as well, these CTCs and the cells are taken up and identified, and then further processing is done.
I was just going to ask, so I'll cut you off real quick and ask a question. So the circulating tumor cells, circulating tumor DNA, both of these are dependent on pathology from the original specimen, from a metastatic specimen. What does the process look like of getting that ctDNA? Can you just walk us through that a little bit, just the basics of it?
Yeah, so CTC, so circulating tumor cells and circulating tumor DNA. These two technically are based from the tumor itself. It can be either from the primary site or from the metastatic site. The circulating tumor cells are the direct tumor cells which are um, which get dislodged in a simplest way from the metastatic site or from the tumor site, and it is circulating in the blood. Whereas circulating tumor DNA, this could be from the broken cell at the primary site or at the metastatic site, and just the DNA itself is circulating around. So
Gotcha.
kind of it is similar, but just it has some minute nuances and understanding what exact difference between those two are. CTCs are kind of whole cells which are getting dislodged from the primary or metastatic site, whereas DNA, ctDNA is just the DNA, which is coming from sometimes a necrotic tumor cells and circulating around.
And so is it safe to say that these are in essence interchangeable, or are there some advantages that come from CTC versus ctDNA that make one more better in certain circumstances than others?
So, in a comprehensive way, I would not say it is purely interchangeable because when we look into different mutational analysis in this ctDNA or again cell-free DNA or CTC, all of them have some different benefits and advantages over one another. And therefore, when liquid biopsies are done, depending on what platform we have used, they will be analyzing either CTCs, CTCs plus ctDNA, and so on and so forth.
Got it. And now, correct me if I'm wrong, but I think renal cell carcinoma typically is known to not shed ctDNA as much as some other tumor types. Can you talk a little bit about why that is and why, despite that, you're still seeing some utility in these liquid biomarkers here?
Yeah, so uh, renal cell carcinoma is considered as one of the cancer where the tumor cells are not getting out into blood as much. But one of the main example where it would be extremely helpful is for those patients where biopsy is not possible. In this particular patients, the information that we can just get from whatever CTCs or ctDNA are being circulated, that can give us enough information to either sometimes predict whether this is a renal cell carcinoma or not, or sometimes also to help us prognosticate in cases of recurrence or on how this patient's survival outcomes would be. So it's very helpful in those patients where biopsy is not enough possible. And then again, in our review, we talk about many newer studies which are kind of giving us more information that it can be used in a complementary way. So this CTCs and ctDNA can sometimes give us more mutational information as well, which might not be available just through tissue biopsy. And I'll explain you a little bit why. So RCs is also considered as one of the tumor which has highest tumor heterogeneity, which just means when we are doing a biopsy from the primary site versus when we are doing biopsy from the metastatic site, the mutational analysis or the mutation inside the tumors might be a little bit different. And when we do from liquid as well as tumor biopsy both, it can give us sometimes more information of the tumor mutational burden and different mutation and targeted mutations as well.